It's just that the constant fight that I feel like it's hard to not feel like that I'm not doing enough.
It's everything, at work, at home.
There's so much frustration and heartbreak. We lost a lot of patients.
It's kind of devastating, honestly, because, all of us in healthcare are seeing it.
Just believe that it does exist.
If it's not actively affecting us, that you're just scared that it's going to at some point.
I know I'm a good nurse, but COVID's better.
A year ago this week, Ohioans started getting COVID vaccines. The first doses went to people like the ones you just heard from, healthcare workers.
And since then, more than 6.8 million people in the state have had the shot. But as the number of doses in arms changes, so too does the virus. And wave after wave, the people working in our hospitals have had to fight.
And in a socially distanced setting in downtown Dayton, News Center 7's Molly Kowick talked with them about the last 2 years.
I think I've shed more tears in the last 2 years than in my 45 years of life.
The loss, the large amount of loss, more than normal.
We're living every day with an undercurrent of stress and concern that we didn't experience before.
It's been an emotional roller coaster. Constant influx of information that's changing, and you have to adapt to it.
Seeing a lot of death more than usual.
It's been frustrating and a little overwhelming.
COVID has consumed my life, working in the emergency department.
The worst day was, I have this image in my head when there was like 4 crash carts down the hallway and patients coding 3 patients at a time, and they're running codes, multiple codes at once. That's the biggest images that are like engraved in my brain.
I think our worst day, and in general, is just not having enough staff, and so everybody is working absolutely as hard as they can, doing the best that they can to take care of patients. And when we either don't have enough people or enough resources, it just doesn't feel like enough.
I think for me, one of my worst days was actually just recently. I had lost 2 patients that I was caring for in under an hour, back to back. It was just a very hard day. I cried a lot. Then I came back a couple of days later and I lost another patient.
Talk to me about the emotion or the feeling you have of people who still don't think this is real, people who still are not taking this seriously.
Sometimes you feel like you're talking to a brick wall. You're trying to convey what you're seeing every day and what is hurting your heart and just devastating your entire life. It's not just at work, it's at home, it's everywhere.
Every day taking care of positive COVID patients, it's real. It's real. It's no personal gain for myself or any other healthcare workers. We have nothing invested in this other than trying to take care of people that come through the door.
You feel sad for them because, we're living in a world where this is huge and it's everything, and some people still can't look at that and understand that, if we all worked together, we might be in a different place.
It's not a political battle for me. I'm going to take care of you in the hospital, whether you believe or you don't believe, whether you're on board or vaccinated or unvaccinated, any of that. When you come in those doors, we all take care of you, no matter who you are or what you are. To feel like we have to defend that is just a whole different battle.
It's incredibly frustrating. Early on, we were looked at as heroes in the healthcare. That was nice. We were all scared and, understand. But now it's almost, everybody has their own opinion of COVID. Everybody has their own ideas of how we should treat it and how we should go about our lives, and all while we're still working through it.
You know, you all went through a lot of medical training. Nothing could have prepared you for this.
You know, we know how to ventilate patients, but when we're seeing their lungs, you know, deteriorate, and we're seeing things that have never been associated with respiratory viruses that we've seen before, it's been a very significant challenge.
It's like there have been brief moments of reprieve, but then we get hit with another wave. We get hit with another variant. What's that like to work in those conditions?
COVID, just when we thought we had it beat, it's smart. It was converted or whatever happened to it to become something different. It got strong again. We have more patients. People are sick. We found a different method of treatment. So we thought we had it licked again. And it just comes back for more. It's hard not to feel like, when is enough enough? When are we going to see the end? That tunnel, the light at the end of the tunnel, it gets further and further away. And it's very deceptive, and it is discouraging.
I want to take a moment to sincerely thank those healthcare workers for taking the time to meet with me. I know how busy and stretched they've been for the past 2 years, but I also know how important it was to hear directly from them. So our series continues tomorrow when they'll explain the impact that unvaccinated patients are having on our healthcare systems.
This is just something that we have to live with, and so we need to be smart about it.
It's so frustrating that, you know, you want to say, you know, look at all of the people that are vaccinated. Look how well we're doing.
And it's really terrible when you feel like all that teamwork and it's just still, you're still losing people and it's just still not good enough. COVID is vicious.
Seeing a lot of death more than usual.
You know, we're living in a world where this is huge and it's everything, and some people still can't look at that and understand that, you know, if we all worked together, we might be in a different place.
Pfizer, Moderna, Johnson & Johnson, first dose, second dose, booster, all terms so many of us have added to our regular conversations.
December 14th, 2020, the first people in Ohio started getting COVID vaccines. Now there is more supply than demand. But state data shows the sickest patients are the ones who haven't gotten the shot.
And News Center 7's Molly Koick sat down with a group of healthcare workers from our hospitals. Here's what they want you to know about getting vaccinated.
But of all the patients that I've taken care of, been vaccinated and unvaccinated, for the most part, those that are unvaccinated require more oxygen. They're typically sicker. They typically have more of the effects than those that are vaccinated.
How we had to provide care was different. Kind of protecting yourself.
They say that, you know, only a small percentage of people die, but when you look at the long-term effects that are happening to people's bodies, we're seeing scarring, lung tissue. I know a lot of with the blood clots and things like that, that's never been associated with respiratory diseases before.
I still get angry when people tell me that they don't believe in COVID. I have patients that are on oxygen that I'm caring for. They're like, yeah, COVID's not real. COVID's not a big deal. And I'm like, okay, well, I just need for you to breathe in through your nose and out through your mouth.
This go around, they've been younger, 30s, 40s, 50s, intubated, losing their lives.
There's so much frustration and heartbreak. We lost a lot of patients.
Are you guys scared to go to work?
Sometimes. Sometimes I am scared to go to work. There's a new strain out. I don't know everything about it. I don't know everything about the strains that we have.
I don't know if scared is the right word, but it takes a little more sometimes.
Yeah, I think there's definitely times I get scared. I think the scariest thing about COVID right now for me is losing our healthcare workforce. Everybody's tired. Everybody's working long hours. Everyone is just spread so thin. It's exhausting, and I'm scared to go into work and receive another resignation.
So I wouldn't say scared. You know, we still show up. I think we show up for each other. We show up for the team. We show up to take care of the patients. Since I'm around my mother, my thought was, man, I would hate for my healthy mother, for me to take something to her, but she's healthy, and then this be the thing that takes my mother out. So I said, I have to do it for her.
Unvaccinated people, overall, what are they doing to the healthcare system?
Outside of spreading the virus, some of the worst things are spreading the idea to not get vaccinated. To me, that's almost as scary as spreading the virus, is spreading the idea that you don't need this vaccine, or that it's not helping, or that it's not the answer.
What's that like, having unvaccinated people refuse to get vaccinated after the work that you've done for the last 2 years?
It is a little frustrating, but I think the power of choice is what this country is all about. I would encourage everybody to get vaccinated.
We're a year past having these vaccines, and look where we are.
Look at, all the people that have been vaccinated and use them as an example for what the good things can come from being vaccinated. The less severe illness, less of the long-term complications, and that, people that have gotten vaccinated were doing well.
I personally see a lot of viewpoints change when it's been affected personally. Eventually, everybody is going to get affected personally by COVID, whether it's happened or not yet. They will.
I do wish sometimes that some of the public could walk through our units and see what we see. Maybe that would be a way to change things.
Do the things that you can to help the pandemic, get vaccinated, wear a mask, try to protect those around you, because in that way you're protecting healthcare workers too, and I think we all could use a little extra help these days.
What is your message for people who think that this is over?
I definitely don't think this is over. I don't think this is going to be over for a long time, if ever.
We're just as good at surviving as a virus is. And so we just have to be creative. We have to stay on our guard. And I think that we just will adapt and will continue to adapt to the viruses as they change and as they come.
Once again, I want to thank these healthcare workers for meeting with me. They used their own time because their messages were so important. So please join me in taking them seriously. Molly Cowick, News Center 7.